Hi guys, good evening. Good evening everyone. My name is Amr Ibrahim. I'm one of the MTS Medical Academy instructors. Welcome back to the AKT. And as a part of the AKT crash course, we done some crash sessions as well for the stats, and we done the AKT stat sessions over 9 hours of interactive stat course, plus another about 6 hours or 5 hours and more of admin course. So today we'll just discuss a very important topic in the stats about risk, ratio, and case plot. Very important. We had many questions, guys, about case plot, and it was making confusion for many colleagues. We tried to break it down. We tried to simplify things in case plot so it will be easy for you. And I hope after today's session, whatever the questions in case plot, it will be very easy for you guys to answer in the exam with confidence, even if you understand the concept very clearly. Kids plot in the exam should not take more than 20-30 seconds maximum to finish it. Before we go, guys, for kids plot, I need to give you a little bit of background and basic knowledge and solid background about what is risk, what is ratio, because we will apply this in kids plot. Once you understand this, you will find kids plot is very, very easy and very simple. Believe me, you will enjoy even making many kids plot questions in your exam or in your AKT preparation. Before we start, if anyone would like to register or join our MTS group, or I will call it MTS family, guys, on AKT and Telegram, we post a free materials on a regular basis on Telegram channel. We also free sessions that we do on a regular basis for AKT and SSE as well. And we also have on our website a free materials. Even if you don't want to register for any course, it's absolutely fine. You can just use the free materials. And we've done some good free materials, especially, guys, for example, dermatology, because I know many GPs don't like dermatologies, the dermatology chapter, because many things are confusing. All the skill lesions look similar to each other. We tried to make dermatology in a very well organized way. It took from me more than 1 month only to prepare for dermatology. Okay, because I put many efforts for that, because dermatology was one of my weak point. Thankfully, now dermatology is one of my beloved field in the GP practice, and when I have dermatology patient, I feel very confident in managing different dermatology skin conditions. All right, so let's move forward, guys, and we can start. So when we say risk, it means in stats probability. And when we say absolute risk, we means probability of something to happen. Probability of something to happen. Your chance or your probability to have a cancer, to have a heart attack, to have a stroke. Okay, that means, what does absolute risk mean? Very important to put these two tiny concepts in your mind. So absolute risk, what is the probability of something to happen? How you can calculate it? This is the most important. How to calculate the absolute risk? It is the number of the events of interest divided by total number of events. I didn't here explain odds, ratio, and all of that, but put in your mind in absolute risk, number of the events of interest divided by the total number of events. Focus on this. I didn't include many other equations. All I need you from this short video to focus on what I'm giving you in this video. Why? If you focus on that, you absorb it well, then you go to study another part of the stats, so you will not confuse both together. So absolute risk, number of events of interest divided by total number of events. Let's say you have a patient referred to colonoscopy unit, and they are keen to know the probability of having colon cancer diagnosed. Using the table below, what is the absolute risk of being diagnosed with a colon cancer? What is your probability to be diagnosed with a colon cancer? So let's say, guys, you have some patients going to the colonoscopy unit, and they diagnosed 100 patients to have cancer. Most of the patients, 2,500, they don't have cancer. How you can calculate the absolute risk? Yes, correct. Well done. I hear someone saying we will put 10 and divide it by 2,600. Why? because we mentioned total number of events, and total number of events here are the total number of the patients that went for colonoscopy, not only the patient number that didn't have the colorectal cancer, but total number of people that went for colonoscopy. So 100 divided by 2,600. Okay, so then it will be at the end 3.8%. 3.8% of people who go to have colonoscopy, it will turn up or they will have a colorectal cancer. All right, absolute risk reduction. Absolute risk reduction. What does that mean? Absolute risk reduction in a very simple way, how much is a baseline risk change with an intervention? Okay, in another way, it shows how much a treatment reduce the risk of having adverse effect. Okay, so how much a treatment reduce the risk of having adverse effect compared to the control group. So how you can calculate it? How you can calculate it? Absolute risk reduction is the difference between the absolute risk in the treatment and absolute risk in the control. Sometimes the value at the end will come positive. Sometimes the value will turn to be negative. It make difference actually not that much, but just it's worth knowing that there is something called absolute risk increase. Absolute risk increase, we use it, for example, if we are trying to compare the smoker and non-smoker with a bad outcome, the probability or the absolute risk increase for lung cancer in a smoker compared to non-smoker, in stomach cancer, in alcoholic compared to non-alcoholic. That's why you will have it in positive value. The absolute risk reduction is the difference in risk in the treatment group compared to the control group. Let's have an example. So in a trial, 10% of patients in the control group had a heart attack, but only 6% of patients in the treatment group had a heart attack. What is the absolute risk reduction? So you will find out the difference between them. It will be 4%. Here in minus, yeah, it is absolute risk reduction, and we subtract the control, which is larger, 10% compared to the treatment. So that's why the value in minus. What does that mean? That means having a heart attack is 4% less in patients taking a statin compared to the patients that they don't take statin. Okay, very important. So the absolute risk reduction here -4. That means the chance or the possibility of having heart attack is 4% less if you are taking a statin compared to if you are not taking statin. Why sometimes it's positive? There's something called absolute risk increase. For example, absolute risk of developing stomach cancer in people who drink alcohol is 7% higher compared if you're not drinking alcohol. That's why sometimes it's negative, sometimes it's positive. What I need you to know and to remember, because we will use this shortly in Kate's plot, absolute risk reduction or absolute risk increase is the difference between the absolute risk between the treatment and control group or intervention group and control group. Moving forward, how to work out or calculate the ratio? The ratio is the group of interest over the group or divided by the group of control. For example, relative risk or risk ratio. Relative risk or risk ratio, how likely something to happen in one group compared to the another or compared to the other group. How likely something to happen in one group compared to other group. So relative risk is the absolute risk in the intervention group divided by the absolute risk in the control group. Again, if you divide interest or treatment group over the control group, you are calculating the risk ratio or relative risk. If you are finding the difference between them, you are finding the what? Yes, I hear someone say absolute risk reduction. Did you find the difference here? You have here absolute risk of intervention and absolute risk of control. If you divide the intervention over the control, you are getting the risk ratio. If you are finding, okay, or subtracting one value from the other, finding the difference between them, you are calculating the absolute risk reduction. I hope, guys, you are not confusing yourself with this. We are trying to make it very simple, very easy for you. All right, so the ratio or relative risk ratio or risk ratio, so you are dividing absolute risk of intervention over the absolute risk of control. Let's have an example. For example, a study is conducted to assess the effect of a new diet on development of type 2 diabetes. So the data came from the study. They exposed the group to the new diet. 500 people took that new diet. 50 people developed diabetes. In unexposed group, 600 people remained on the regular diet or old diet. 90 people from them developed diabetes. How you can calculate the risk ratio? Risk ratio we mentioned, we need to find absolute risk of the interest or intervention group divided by the absolute risk in the control group. What does that mean? Where is the intervention group here? The new diet people. So calculate the absolute risk. It will be 50 over 500. Then the absolute risk here in the unexposed group, it will be 90 over 600. Then you had the absolute risk for every group. Then you divide the interest over the control group. Then you will have the risk ratio. Risk ratio, okay, here, exposed group, 50 over 500, 90 over 600, and then you divide both together, 0.10 divided by 0.15, it will come at the end 0.67. What does that mean, 0.67? Listen carefully, because many people confuse themselves with this point. So the relative risk, we are comparing the risk between two things. Okay, someone taking new drug, new medication, new diet, whatever, or had the intervention, comparing to the control group. The risk came 0.67. What does that mean? That means having a new diet reduce your diabetes risk by 33%. By 33%. Okay, very important. So the relative risk again here, again, of 0.67, meaning that the participant on the new diet have a 33% lower risk of developing diabetes compared for those who are taking the diet. So you are trying to find out what is the remaining from this value. The remaining from this value is 0.33. 0.33. We need the percentage, so it will be 33%. For example, let's give you another example. If this value came back 0.80 or 0.8, what does that mean? That means people who are on the new diet are 20%, okay, or having a 20% less chance to have diabetes compared to the people who are taking the old diet. If it was 0.9, what does that mean? Again, people who are taking the new diet having 10% less chance to have the diabetes compared to the people who are taking the old diet or regular diet, and so on. I hope it is not confusing you. This table is good, and I like always to put everything in tables. Even the AKT course, all of it is done, or most of the course is done in a table style. Everything you will find in the AKT course, most of the information you will find in tables. So the relative risk, if you have relative risk equal 1, what does that mean? That means your intervention is useless. Okay? There is no any difference between both of them. The new diet is the same as the old diet. Is doing nothing. Your medication is doing nothing. If it is relative risk is equal to 1. If relative risk is equal to 2, that means the risk doubles in the intervention or exposed group. And if it is 0.5, that means the risk is half or 50% risk in the intervention or exposed group. 50% less or half the risk in the intervention or exposed group. I hope it is easy, guys. Let's go further. Relative risk reduction. How you calculate is very easy now. Relative risk reduction is 1 minus the relative risk. Relative risk reduction tells you what percentage the risk is reduced in the treatment group compared to the control group. What percentage the risk is reduced in the treatment compared to the control group. Relative risk reduction, 1 minus the relative risk. We need the in percentage because it is a percentage. That's why we multiply by 100. Again, Another way to calculate, I always like 1 minus relative risk multiplied by 100. Let's have a case or a question or example so it will stick in your mind. So a trial examines the effect of a statin on the risk of heart attack, and then you had the outcome of the study. Control group, they didn't take statin. 15% of patients had a heart attack. So that is the absolute risk of having heart attack in the control group is 15%. Treatment group who take statin, 10% of patients had a heart attack, which means the absolute risk of the treatment group is in the treatment group, 10% had heart attack. This is the absolute risk. So how you can calculate relative risk reduction? First of all, get me or calculate for me the relative risk. If I told you absolute risk reduction, okay, you will find the difference between them. So it is 5%. If I tell you find for me the relative risk or relative or risk ratio, you will divide. You will divide 10 over 15. Please, 10 over 15. Here, what is the trick? Who put for you the control group first is expected. Why? He's testing your knowledge. Are you dividing treatment or intervention over the control or control over the intervention? No. Treatment or control over the intervention. So the treatment or intervention, you divide over the control. So you will have the risk ratio or relative risk. Then the relative risk reduction is 1 minus relative risk multiplied by 100. So it will be 33. What does that mean? That means 33% less. So that meaning that statin reduces the risk of heart attack by 33% compared to no treatment. Well, I hope guys you understand now risk, ratio, and then we move forward to have something fun. I like case plot. And I believe after you listen to today mini stat session, I will call it mini stat session, I hope guys all of you guys will like Kate's plot. Kate's plots. All right. So you will find that very nice faces. And sometimes Kate's plots, they will give you half page of lots of things. A patient came to you, they had heart attack, they are interested to know their chances of having heart attack, if they take statin, if they are not taking statin, blah blah blah. Many things that you don't need. The most important in Kate's plot, look straight away to the faces. So what does the faces tell you? The green faces tells you those people are very lucky. They will not have a heart attack, they will not have a stroke, they will not have cancer, they will have a good outcome if they took the medication. If they didn't take, it doesn't matter. So these people will have good outcome all the time. The green faces. Red faces, these people are very unlucky. They will have the bad outcome if they took a statin, if they didn't take the medication or took it, it doesn't matter. So if you give them the treatment, if you didn't give, these people are very unlucky. So you will have always bad outcome. Yellow faces, they are also lucky. But when they are lucky, they are only lucky if they took the medication or intervention. Do you know, guys, do you know what? We are treating this 100 Kate's plot, the number of the faces always 100. We are treating this 100 only for the sake of saving those yellow faces. Again, and very important, we are treating this 100 to have more yellow faces, to save those yellow faces from having the bad outcome. We are not treating them to turn the red faces to green or yellow. No, red faces will be the same. If they took the medication or not, they are very unlucky. The most luckiest is the green faces. The second category that they are lucky, the yellow faces. We are treating all of the 100 to save the yellow faces. Because we will need this, I'm telling you now, we are treating this 100 to save these yellow faces because we need this information for what? To calculate number needed to treat. So now we understand the green, red, and yellow. Sometimes you will have green faces, and green faces, it will has cross on it. That means these people had a side effect from the medication. These people had a side effect from the medication. Sometimes you will have a green face with cross. These people has side effect from the medication. we will need this green faces with cross to calculate number needed to harm. All right. Let's have an example. So you will have many in here, one example, and please guys focus carefully because it is a good example, and I will tell you the trick, or I know most of you will not fall down in this trick because this is the most basic question about Kate's plot. So using that Kate's plot, if you have 100 diabetic men took simvastatin, what number would you expect to have cardiovascular event in the next 10 years? What do you think? If you give this 100 statin, how many people will have MI or cardiovascular illness or stroke or whatever over the coming 10 years? Well done. Someone mentioned about 11. Yes, it is 11. Why? They are asking you here about how many red faces in this question. One row equals 10 faces. So you have here one red row equal 10 plus one red here, so it is 11. This question asking you how many red faces. If you are treating all of them with statin, how many will develop stroke? We mentioned about these red people are very unlucky. They will have the stroke if they took statin or they didn't take. Okay. So it is 11. Let's twist the case and I will only add only one word. If 100 diabetic men didn't take statin, I just added didn't. None of them took statin. How many people will have cardiovascular event over the next 10 years? All of them. We didn't give anyone a statin. How many will have cardiovascular event? Well done. Someone mentioned here he is asking about the red and yellow faces. Why? Because now the yellow faces, if we didn't give them a statin, they will develop the stroke. They will develop the cardiovascular event. So you here, he will ask you about the red faces and yellow face. So it will be 10. Sorry, it will be 16. 11 red faces plus 5 yellow faces, so it is 16. Okay, please read the question very carefully so you understand, is he asking about red or yellow faces or both of them? Then lots of stuff written here. I don't have time to read, and I assume in the exam you won't have time to read. So try to pick up quickly what he's asking about. What is the number needed to treat for antibiotic in acute sinusitis? So he's probably here in this case plot telling you that they are giving antibiotic for acute sinusitis, asking about number needed to treat. So I explained a couple of minutes ago that we are treating 100 to save 4 or to save the yellow faces. So we are treating 100 to save the yellow faces. But it is not the number needed to treat. You can't say here it is 4. Why? Because number needed to treat, how many people you treat to save one life. Here, we are treating 100 to save 4 yellow faces. It might be 5 yellow faces. It might be 6 yellow faces. You will be very lucky if you will have only 1 yellow face. That means it is a number needed to treat 100. Because you need to treat 100 people to save one face or to save one patient. So, number needed to treat, how you can calculate it here. You are treating 100 to save 4 faces or 4 lives. So how many you treat to save 1? Very easy, 100 over 4. 100 over 4, so it will be 25. And here is the calculation. We are treating 100 to save here 4. So how many to save 1? So 100 over 4. Someone doesn't like too much complex situations and he would like to know just the equation to quickly make it. Well, it's very easy. How you can calculate number needed to treat? 100 divided by the number of yellow faces. 100 divided by the number of yellow faces, it will give you number needed to treat. What is the number needed to harm? 100 divided by the green crossed faces. This green crossed faces. This is the number needed to harm. All right. I hope it is now easy. Okay, and I hope it is now uh, making sense for you. Why? Because now we jump to something little bit, not that much, little bit needs little bit of your understanding of the basic concept. That's why we started today with the explanation, what is risk, what is ratio, before going to the coming questions. Let's use the same case plot, because all we need is a concept. Then he's again asking many things. Okay, what he wants here? He wants here to calculate the absolute risk of a stroke in patients not taking aspirin. Then he's asking you the absolute risk of a stroke in patients taking aspirin. Then he is asking you calculate the absolute risk reduction. Another question which is very easy now, number needed to treat, so it will be 100 divided by the number of your faces. Then he is asking relative risk of a stroke with aspirin compared without aspirin, relative risk reduction. That's why we started this mini stat session explaining the basic concepts before going or jumping to case plot. So everything can make sense to you. So the whole topic will be very easy. Let's go step by step. Absolute risk. We know from the first early in the session, absolute risk is a probability of something to happen. Probability of a stroke to happen if those 100 didn't take aspirin. So it will be the number of the event of interest divided by the total number. So I'm interested by those who will develop a stroke if all of them didn't take aspirin. In another way, he's asking about the red faces, because if we didn't give aspirin, okay, so how many will have? Sorry, guys, again, he's interested here to ask about the red and yellow faces, not the red faces. Again, if we didn't give 100 for these people, how many, if we didn't give aspirin for this 100, how many will have a stroke? It will be the red and yellow, because those yellow faces, if they didn't take aspirin, they will have a stroke. They will have a stroke. So in another way, he's asking about red and yellow. It will be 14 divided by 100, so 14%. The absolute risk of a stroke if they are taking aspirin. So if we give 100 aspirin, how many people will have a stroke? All these red faces. It will be 10%. Why? Because if we give all of them a stroke, 4 faces will be saved. 4 patients will be saved. So these 4 patients will not have stroke. So they are lucky. They will be saved. Okay, I hope now it is very easy. Absolute risk. We know that what does that mean by absolute risk. And if they didn't take aspirin, he is asking about red and yellow face. If they took aspirin or took the intervention or statin or whatever, okay, so he's asking about if they are taking, they're asking about only the red faces, because the yellow faces will be saved. Yellow faces will be saved. Absolute risk reduction. Absolute risk reduction. 2 ways to calculate the absolute risk reduction here. One way, we mentioned absolute risk reduction, you are finding out the difference between the absolute risk in 2 groups. And the 2 groups, if they don't take aspirin or if they take aspirin, so 10 and 14, the difference is 4%. This is absolute risk reduction. Or another way, absolute risk reduction is yellow faces divided by 100. Do you know, if you reverse, if you divide 100 divided by 4, the number of the yellow faces, you are getting the number to treat. If you are making the opposite, the yellow faces divided by 100, you are calculating the absolute risk reduction. The absolute risk reduction. I hope it is clear. I hope it is clear. Okay. Where is that? Sorry, just came out. So absolute risk reduction. Okay. Number needed to treat, we already know that. 100 divided by the number of yellow faces. If yellow faces in the upper part, and then you divide, you put yellow faces divided by 100, you are calculating absolute risk reduction. Or absolute risk reduction, as we mentioned, is the difference between the 2 absolute risks, the intervention and control group. Here, control group assuming it is the 100 without the intervention, and the intervention group 100 that you give them the treatment or statin or your intervention. All right. Number needed to treat, okay. So we calculated 1, 2, 3, 4. Let's go to relative risk of a stroke with aspirin compared without aspirin. You remember? Absolute risk reduction, we are getting the difference between the two absolute risk. Relative risk, you divide the intervention over the non-intervention or control. So it will be 10 divided by 14. I hope, guys, now you understand. Absolute risk reduction, if you have the two absolute risk, intervention and control, you find the difference between them. Relative risk, you don't get the difference, you divide them. So you get the absolute risk reduction of the treatment, okay, divided by the control. So it will be 10 over 14. A relative risk reduction, it will be minus 1 minus the relative risk. 1 minus the relative risk. I hope it is clear, guys. Here is the answer, but I explained the answer to you. Again, absolute risk of patients, or absolute risk of stroke in patient not taking aspirin, he is asking about red and yellow. If we didn't give aspirin for all of them, how many will develop? It will be red and yellow. Again, if you would like to know, yes, in shapes or colors, red faces plus yellow faces divided by the total number of faces, it will get you absolute risk of whatever if they didn't take the intervention or medication. Absolute risk of a stroke, if they take, they are asking about only red face. So red face divided by the total number of faces, which is 100. Absolute risk reduction, either you get the difference, which is 4, or yellow faces divided by total faces, or the 100, so it will be 4%, whatever way you would like to make. Okay. Then number needed to treat, we mentioned about this. Then relative risk. Relative risk we mentioned, instead of getting the difference between them, no, you divide them. You divide the treatment over the control. So treatment here, those who take statin, the absolute risk for these people are 10, divided by those who didn't take statin, it will be 14. So it will be 71.4. Relative risk, it will be minus 1, sorry, it will be 1 minus 71.4, it will be 28.6 about. Okay. If you would like by faces, again, you will find the faces. For example, relative risk, if they are of stroke, if in the intervention compared to the control, or the intervention compared to without, red faces divided by red faces plus yellow faces. If relative risk reduction, it will be yellow faces divided by red faces and yellow faces. I hope, guys, it's clear. I hope now it is very easy for you. I try to make it as simple as possible with a little bit of background before. And if you would like a table as well, just to summarize what you need to know and how you can do different calculations with Kate's plot, all in one table. Again, I like tables. Most of our AKT and SSA materials and course made in tables. And I hope it was very useful for you guys. If you liked the video and you think it may benefit your colleagues who are sitting for AKT exam, you guys probably can pass it for them. At least they will understand more about the risk ratio, how to calculate the risk ratio, all of that, and Kate's plot as well. And all the materials will be on the website. All the courses will be on the website. And if you would like to join our groups, feel free to join our family, either for on WhatsApp or Telegram. All the best, guys, and I wish you a very easy exam, and all the best for your AKT, SSA, and for your CCT. Good night, and see you in another video.